All patients living with serious illness and their families benefit from supportive and palliative care. The goal is to improve the quality of your life and be certain that the care you are getting fits your healthcare goals. Think of your body as a bridge. As your body ages or you face serious illness, your bridge gets weaker and may start to crumble. Supportive and palliative care adds an extra layer of support to your bridge to keep it strong. We are experts in the management of pain and other symptoms. We treat you with respect, and we help you feel better through emotional, social, and spiritual support to get down to how you really want to be cared for. Supportive and palliative care helps patients of all ages at any stage of a serious illness and is arranged with your medical care. You can be seen if you're staying in a hospital or if you come in for a visit, or if you're at home with hospice care. Studies have shown that people who get supportive and palliative care have fewer symptoms, a better quality of life, decreased depression, and even a longer life than those who do not get palliative care. At the University of Iowa Hospitals and Clinics, supportive and palliative care is a multi-talented team made up of nurses, doctors, social workers, chaplains, music therapists, and pharmacists. The team is focused on the needs of you and your family to make sure that your voice is heard and that the care you are getting meets your needs. Many of our patients go on to live healthy lives after they receive care from the supportive and palliative care team.
The important thing to understand about the supportive and palliative care team is that they are listeners. They will listen first to what your concerns are. They will present you with information. They will help you to sort through what your values and your wishes are for your long-term care, whether that be end of life or in the midst of a major medical crisis.
While some people, I think, might think of palliative care as aligned with hospice kind of care, that's really not what our experience was. We were at a time when we needed every single resource that this hospital had to offer, and we were fortunate enough to receive that and to have a good outcome from that.
We were not sure what was going to happen next when they admitted my dad to the emergency room. We were admitted into a room that allowed us to have both privacy and peace and quiet, but also the support of the palliative care staff, the nurses, the doctors, folks that were there taking care of him and us morning, noon, and night. That last week, those last days were reassuring. They were spiritual. They were bonding for the entire family. To know that there is such a caring, peaceful, and transitional place that can help all of your family members to transition and understand what is happening when it's happening. I think it was difference-making for us, and I would suggest would be for anyone who would consider it.
I was at the farm when I got a call that she had fell. We knew it wasn't good, so we got moved up to palliative care, and that was a great experience. We were trying to decide whether to go there or go to a nursing home. You know, it's a tough decision the first day.
When your loved one is in that condition, to be able to feel calm and to be able to get whatever you need whenever you need it and not feel like you're imposing on anybody, we honestly felt like we were the special one, and that's their approach. It seemed like it was just a breath of fresh air in terms of the way that we were treated there.
My mom came in on a Monday and she died Friday. So Monday was a hard day, and a lot of decisions needed to be made. And what was real apparent is that we were in an environment where we didn't have to ask a lot of questions. They were there to help us. They all coached us through this process. One of the suggestions was to put your hands together with my mom, and so we had the multi-generation hands together.
These families had amazing experiences with palliative care. It's never too early to add supportive and palliative care to your team. If you would like to meet with a supportive care nurse, please ask your doctor or other healthcare provider.